Technology has simplified the dissemination of much-needed information to societies. Bayer Afrika has partnered with Empire Partner Foundation to raise awareness on women's health and sexual and reproductive education. The initiative will bring together some of the most talented young minds, influencers, policymakers and experts to develop innovative ways of educating women about their health. Now, for more on how this technology will help drive this initiative, I'm joined by Tina Visser, who is from Bayer South, East and West Africa. Tina, thank you for making time for us this afternoon. What's the motive behind this program?
I think, I don't need to tell you people, I think you definitely have reported on all the unplanned pregnancies that we have in South Africa. We've got a huge rate of unplanned pregnancies, huge need of knowledge for women, to empower them with knowledge and information about women's health in general, but then also more specific around their sexual and reproductive health, as well as the rights that they have. And that's our main mission, is really to empower women so that they can make choices, so that they can have children by choice and not by chance.
Mm-hmm. And I mentioned earlier that you're bringing together some of these talented young minds. You've got influencers, there are policymakers being represented, experts also, to develop this innovative way of raising awareness and information on women's health and sexual reproductive education. Let's talk about that aspect of technology, because that can be used as a tool to solve some of these key socioeconomic challenges that we face today. Are there opportunities to provide young people with access to technology and these digital skills training in dealing with these challenges?
Yes, absolutely, and that is what this hackathon is all about. It's finding the right tool to impart all this knowledge that we have, that these experts have got, really finding a way in a channel that speaks to the end customer, which is a young customer or a young patient or a young woman. We also obviously are including young men and boys in this as well, because we really want to speak to that target audience in a way that they want to be spoken to, so that they will listen and then use that information and that knowledge that they are gaining in that way. So it's absolutely crucial for us. Technology can help us so much. Our health system is totally overburdened. There's just too many patients, too few healthcare professionals, and then the time in front of the healthcare professional, it's so quick. So we really need to make sure that the patient asks the right questions when they get in front of their healthcare provider, whether that will be a nurse or whether that will be a doctor, and then also for the doctor to make the right choices. So we want to prepare both sides of the coin, helping to, into having a better conversation, better counseling to happen around specific contraceptive needs. And then obviously it will hopefully save us time and save us money, so that we can reach more people with the little resources that we already have. And technology is absolutely the way to go.
Yeah, and why is it, do you think, so important to also involve young people in this program? I mean, I'm just thinking that normally they've got these fresh ideas, so it helps when, it won't help when you're having conversations about young people without them, especially when they're... Yeah.
Absolutely. They're crucial to this. They are the center of it. And it's just, I could see today when we started interacting with them, they were like, but I don't know this. Why don't I know this? So that, yes, it's because there's this disconnect, also probably, huge disconnect in society in general. But we're really trying to reach the broad population, broad society. And yes, we want to uplift the youth. They've got the energy to do all these things as well. As we grow older, we don't have the energy to do these things. But they're bright minds. They have got no boundaries. They just totally think out of the box. And we want to speak to them. So who better to get involved than the person that you want to reach in the end?
Yeah. What are we expecting from the program today? Did the hackathon then kick off this morning. What's happened so far, and what are you expecting for the rest of the day?
Yeah, so we have started off this morning. We had some keynote speakers on the topic that just gave us some background about the statistics and what the challenges is. So the challenges are, there are basically two challenges. The one is to find an innovative way to increase the knowledge of young women, especially across the different cultures, across the different socioeconomic groups around their knowledge. How can we innovative way to increase their knowledge and general awareness about their sexual and reproductive health. But the counter side of that is also an innovative way of educating our healthcare professionals, whether that's doctors, nurses, pharmacists, anybody in the chain of serving our patients. Also to keep them upskilled on what is the latest new product offerings that's coming to the market. And in the end, to really make sure that each woman receives the right contraceptive method for her at the right time. So that is what we are trying to do. We've kicked off this morning. The people are hacking away as we speak. That it is quite busy. Lots of ideas flying. This is also a hybrid hackathon. So we also have teams that some are physically represented, and then some of them are sitting in virtual, not even in Johannesburg, some are in Durban and in Cape Town. So it's really a across the country initiative, and we hope for them. They will probably be hacking right through the night, and by tomorrow around this time they will be presenting their ideas and their solutions to our team of judges.
All right, wonderful. And then after those ideas have been presented, what's the next process?
And obviously, we would like to have as many ideas that can come to fruition. So I think watch the space. We will definitely contact you. If we then do put them into our incubation hub, trying to get them ready and to be able to be rolled out on a larger scale. And like one of our speakers this morning said, you're not just hacking for South Africa, you're hacking for Africa, and this can really change the world.
Definitely. Tina, Visser, thank you so much for making time for us.